So the topic what I have is about aphorisms of local disease and its application by evidence-based case studies. Yeah, I mean there are almost 185 to 203 aphorism which goes for local disease on external plane. What is about dermatology? One-sided disease on internal plane goes with mental disease, that is 210 to 230, which we are not going to touch up because the topic is on dermatology. So I will be having a flying view on the aphorisms of the Organon. You will have a clear idea about it. You can ask me questions later on as well, and along with that I will show you some of the cases on evidence base. You get an idea how Organon is actually, you can feel, you can palpate the words of the Organon in practice. You can really feel the pulse used by Hahnemann in the book Organon in your by your own hands. Now going towards a kind of a flying view or a bird eye view on the aphorisms of local disease, where I will be telling you the most important points into that. Right? Point number one. What is local disease? Hahnemann has said very simple. Local disease is two part, either on the internal part or on the external part. Internal part goes for mental disease. External part is for local on the where you can see the problem. So here dermatology, the problem on the level of skin belongs to the local disease on external parts of the body. In this, allopathic science used to tell that basically allopathically, I would say they have taken a concept of reductionism. I have said many times, I hope you must be aware that allopathic science has taken the concept of reductionism from body into system. And we have specialists. I'm a gynecologist, I'm a nephrologist, I'm a dermatologist, I'm a neurologist, I'm a cardiologist, I'm a pulmonologist, right? I'm an orthopedic, etc., etc. So allopathic science took the concept of reductionism. Homeopathy took the concept of holism. As body is made up from one cell, whatever symptoms appeared on the different parts of the body are scientifically interconnected. So in 185 aphorism, Hahnemann gives the difference. Allopathy usually believes that the local disease is a local issue, is a local problem. It has nothing to do with general. Here, what allopathy tells that these parts were morbidly and locally affected, and the rest of the body did not participated in the disease, which is a absurd doctrine. Hahnemann says kind of a nonsense. This is not logical, right? So Hahnemann in 186 aphorism, in 186, 187, I will give you point by point so you get an exact idea that what is all about, and then we can take the question answer session before going to cases. So this was 185, right? That where Hahnemann tells what do you mean by local disease. Local disease is on the local part of the body. Allopathic says local disease is local involvement, no general involvement. That is 185. 186, what Hahnemann tells that local disease can be from outside, what you call accident. We had an accident, okay? So we did not created the local disease. Our body is, so we have a fracture, or our skin is broken, we have lacerations, we had whatever kind of an injury. Have we invited have we invited the injury? No, we have not invited the injury. So 186 aphorism says that the local disease from external cause, and 187 says local disease from internal cause. Internal cause local disease is from the derangement of the vital force. Here something coming from outside, like you are going by a bike or a car and suddenly you had an accident. Did you invite an accident? Of course not. So here the vital force is nowhere, and nowhere in a situation that this problem has developed. It came accidentally. So now Hahnemann is again categorically telling 2 points, that you have an accident from external cause. Either the accident is minor or an accident is serious. So if the accident is minor, say for example, you were jumping down on from the stairs and you had a fall. But if the injury is trivial, then there is no great moment to take any homeopathic remedy. People take, you have a blunt injury, take arnica. People take, you have sprain, you take rustox. In order to take any homeopathic remedy, you need to have a state of the remedy and symptoms. Simple sprain or simple kind of a problem, let your immunity deal with it. If you cannot deal it, remedies are always there. But being a doctor, you should stay away from the medicines. You let your doctor within you should get the best of, space to recover on its own. So Hahnemann says, no, if the lesion is trivial, there is no great moment for homeopathic remedy. But the opposite, severe. Now we have severe injury. Severe injury, like you are going on a bike and there is an accident and your leg is broken. You have a serious, you have a, neck, what you call injury on the neck, and you're bleeding, your artery is bleeding, called carotids may be bleeding, jugular vein, anything can be bleeding. These type of a serious, where what Hahnemann is severe external cause. Severe. In such a case, if you need primary treatment has to be surgery, then you have to go for first has to be surgery, where it is absolute surgical disease. Suppose the joint is dislocated, you cannot replace, you cannot reduce the joint by medicine, isn't it? Absolutely not. You have to make it fixed and then you give medicine, it will help. Same way, suppose there is a huge cut on the arm and bleeding is profuse, arteries have been cut. You can't give medicines. You have to make it close. The two lips of the wound has to close, and then you have to give the medicine. So in a way, in any situation where you have a severe injury, again the word I've highlighted, severe. If the injury is severe from external cause, that is, treatment should be relegated from surgery first, and then you give whatever medicine you can give. But primary has to be surgery. And in a way, if organism sympathize with fever, what is fever? Fever is a, reaction of a defense mechanism. Suppose, say for example, a thief, chore, a thief is coming in your house. The way you become alert once you know that the thief is coming in your home. Similarly, if the infection is coming in the body following a severe injury, body will react with fever. So what homeopathy does, it respects fever. It respects fever, and we give the best possible, medicine which will calm down the vital force to have a proper recovery. So 186 aphorism is all about injury from the external part, right? Injury from the external can be mild as well as severe. If it is mild, no medicine is needed, there is no great moment. If it is severe, primary surgery, then medicines. This is all about 186 aphorism. And into that, as I said, following surgery, active dynamic aid, homeopathic medicine, active dynamic aid, constitutional medicine, what we say, constant individual is constitutional. So depend upon the state of the patient, we can give the remedy. I am treating so many patients post-operatively. But again, a case needs to be evaluated. So in this way, Hahnemann is talking about 186 has two options. One is trivial, one is severe. If there is severe injury, primary surgery and then medicines. If there is trivial injury, forget it. Let your vital force deal with it. So this is about 186. Now, the next part. Organon is like a index of clinical problems. The what is repertory? Repertory is index of Bertram Medica. Organon is the index of clinical problems. I can't understand why people don't understand Organon, because Organon is so simple. It is absolutely simple. There is no point. Absolutely simple. So here, Organon is clinical problem, index of clinical problem. Now, second problem is 187, acute or chronic local from internal cause. Suppose you had a spicy, tasty food outside, and you develop urticaria, and or you develop food poisoning, or you develop migraine, or you develop whatever. This is actually acute or chronic from internal cause. You and your wife, or you and your girlfriend, or you or your family have gone for a food, right? You all have ate same type of food in a lunch or dinner. Few will develop the problem, few will not develop the problem. So the cause is same, but effect is different. Even the intensity of the problem is also different. So in this way, this is internal cause. Your vital force derangement plays a role for the development of the disease, whether it is acute, whether it is chronic. So in a way, if you have an acute urticaria or acute migraine, whatever, local disease can be any part of the body, any system of the body, not necessarily skin. But if you have any damn problem, be it pneumonia, be it typhoid, whatever name you take, if it is on the physical level, that goes with internal cause, except external injury. That is 186. That is different aphorism. So in this, if they do not arise from any external injury, do not use, remember the word used by Hahnemann, do not arise from external injury. Source lies in some internal malady. There is a problem inside the body and you need to treat it. Otherwise, what will happen? You will land up into same type of problem again. So what Hahnemann tells you, whatever name of the disease you take, leukemia, dermatographism, vitiligo, migraine, constipation, eczema, whatever to whatever, that is because of the internal cause of the disease responsible for the problem. But what allopathy says, to consider them as local affection. Vitiligo is problem with the skin, leukemia is the problem with the blood, right? So in a way they consider local and they treat them locally only, either by surgically or by topical application. And that what Hahnemann says is an absurd and it is pernicious in its results. And as a result, now what has happened is explosion of chronic diseases. Explosion. Now we don't see that somebody had malaria and died, somebody had tuberculosis and died, right? Now what we see, diabetes is in every home, blood pressure is in every home, depression is in every home. Why? Because slowly and steadily, 81st aphorism, there are so many aphorisms in the Organon where Hahnemann tells that local disease is a reflection of the internal miasmatic disease. You respect local disease and treat internal miasmatic disease. What is internal miasmatic disease? Is the root. It's a root. What is local disease? Is a branch. Are you supposed to target the branch or the root itself? You have to treat the root. That's what Hahnemann says. That through branch you can reach the root. It's like a staircase. From the root you can go to the roof. From the roof you can go back to the root. From the, you understand, right? So in a way this is very connected. So Hahnemann tells whatever local disease you say, if the cause is not from outside, the cause is 100% inside, and that's where you are supposed to treat. So this is now the difference. 188 and 189 is the difference. What I said, allopathy is reductionism. Local cause has a local disease has a local cause. The problem is local. Where 189 will say local disease has a general cause, has a common cause. And that's where homeopathy shines. Now chronic disease, which exclude chronic diseases, homeopathy shines a lot because the concept of holism, right? So 188 is reductionism, allopathic concept, which is a misconception. What Hahnemann says, that as if the disease are exclusively limited to the parts wherein the whole body took little or no part. Say for example, I have a vitiligo on my face. That means that my rest of the body is nowhere involved. Only my skin at the face is the problem. Affection, that these are particular visible part of the body, seems as if the rest of the living body knew nothing. Like they don't concern about it. What homeopathy says, 189 is whole body is a family. And who is the principle of the family? Vital force. That's why it said vital principle, right? So in a way, whole family has to work synchronized way, normal sensations and functions. Aphorism 9, 10, 11, 12, 13, 14, if you go for it. So whole body works in a synchronized way with sensations and functions with which we achieve our higher purpose of existence. Aphorism 9. So in a way, this Hahnemann tells here is no, see the confidence, no local disease can come on the surface without internal derangement of the vital force. Yet very little reflection will suffice to convince us no external, see the confidence, no external malady can arise, persist, or even grow worse without some internal cause. Without the cooperation of the whole organism, which must consequently a diseased state. So what is important is something When you are treating local disease, you have to respect the general side of the local disease, because general, this is just a tip of the iceberg. Local disease coming in front of you is just a tip of the iceberg. What you need to do is go at the deepest. That will give you a solution, right? So this is all about, in general, concept of holism. Into that, what Hahnemann tells is local disease though look local, but rest of the living deceased body is the cause for this local problem. Without the permission and support of the law, generalized diseased body, local disease cannot come. And this is an absolute fact, whether you believe it or you don't believe it. It's very true, right? No eruption on the lips, no white law, no can occur without previous and simultaneous internal ill health. This is enough to convince that you have to go to treat the general part, not the local part, right? And into this, now Hahnemann tells that my I cleared my point about how you are supposed to treat. Now, how to treat? 190 is about how to treat. How to treat? If a person comes to you with eczema, will you treat with sulfur ointment? If a person comes with what you call uh, dermatitis, will you give them a petroleum jelly? If a person comes with vitiligo, will you give them arsal flavum cream? What Hahnemann tells so beautifully here, it has to be treated with internal remedies for to produce judicious, sure, efficacious, and radical cure. Otherwise, it's not possible. All true medical treatment of a disease on external part of the body has occurred from little or no injury from without. Must internal remedies should be given. See how Hahnemann is specific. He says if it is from external injury, it's a different story, boss. You just have to think differently. But if a case is coming to you with local problem, physical level, I would say, that's all. You hit it with internal remedies. No external remedies required. And that's why no external application is required. That's why in any classical homeopath, or I would say in any homeopath who is giving single medicine, you will hardly see a combination or ointment, in the practice. I have no combination in my hospital. I have no ointments or liniments or lotions in the hospital. There is hardly a case, one in 6 months, I would say, where I have to tell the patient that please buy calendula ointment to have a fast healing because you had an injury and you are supposed to be using that as a what you call dressing. That's all. That too once in 6 months. Rest internal. So 190 is so specific that the remedy should be given internally to produce judicious, sure, efficacious, and radical cure. Right? Into that, again, now the experimentation. See, Organon is written by experimentation, confirmation, and then submission. So it is not even a single word from the entire Organon is in the air. I have read Organon for more than 450 times in my life. I'm practicing every day on this information. I have not yet found even a single paragraph or a single line, or I would say a single word wrongly placed. So in a way, some books are eternal. Say for example, no, Bible is eternal, Quran is eternal, Bhagavad Gita is eternal. In a way, Organon is a book of homeopathic religion which is eternal. Some points you can learn later on in your life, but you should start using this, right? And this is there is I tell you something very frankly. I am a student of homeopathy like you. Okay, I am also a student. I am learning from you. I'll be very happy to learn from you. I can tell you only one thing. Only one thing. There is only one teacher. I would say there are only two teachers in this world, homeopathic world. If you want to practice, only two teachers in the homeopathic world. One is Samuel Hahnemann. Second is your patients. There is only one sun in this world, that is Samuel Hahnemann. Rest all are stars. It's very difficult. If you follow stars, you will become a star. If you follow the sun, you will shine like a sun. So ultimately, my lecture here, or I would say my submission of the whole life, I've dedicated my life at the lotus feet of Samuel Hahnemann, and till my last breath, I will promote the teachings of Hahnemann, because people have forgotten Hahnemann. Hahnemann is now an option. This should not be the case, right? So how clarity he has given in this literature, and this is what is needed. What we are doing is a bizarre work. This is grounded work. Celebrate this work, practice, get success. So simple, right? Friends, can I have your feedback quickly? I hope I'm able to reach to you clearly. Can I have chats? Thank you, Dr. Matha. Thank you, Dr. Aishwarya. Yeah. Thank you, Dr. Harina. Thank you. Thank you, Dr. Kusum. Yeah. Thank you, Dr. Prasad. Thank you. Fantastic. Fantastic. Okay. So continuing to that, right, this okay. 191. Now is about experimentation. Hahnemann has done a lot of experimentations in his career. We should also do, but a calculated experimentation, right? Not a blind experimentation. Hahnemann has said about now different experimentations. Now 191 to 199, you will see experimentations of Hahnemann. Can we do this? Will it work? Can we do that? Will it work? Can we do this? Will it work? And his experimentations and his answers. Right? Now what Hahnemann tells, that suppose we have found the right medicine. We have found the right medicine. Fantastic. Can we give externally as well as internally together? Suppose if we give externally the same medicine and internally the same medicine, will it work together? Is it possible? If yes, how? Second, if no, then how? If patient comes to with suppression, how to treat? If a patient comes from partial suppression, not complete suppression, how? These all are experimentations from 191 to 199. So in this, Hahnemann says, give internal medication for local diseases, prescribe for the whole state of patient without any external medication, with which general health and particularly the affected part, which is even the far most, even the most far, most isolated, will be cured. So if you have a problem even on the nails of the finger, you have to take a case. If you have a smallest of problem even on the remotest part of your body, even if you have a problem on your hair, even if you have a problem on your feet, even if you have a problem in your fingertips, even if you have problems in your nails, you have to take a case, because you don't treat the disease, you treat diseased individual, which Hahnemann says was treated as a local allopathically, and as a result creating a lot of blunders. So if you treat the case constitutionally, will what it will do? Produce salutary restoration of the health, whole body, along with disappearance of the local symptom. So if you is one of the minister's son, suppose I treated him 2 days back. He had suddenly he had this COVID vaccination, and he reacted with what you call allergy, urticaria, severe urticaria. He had COVID vaccinations almost last Sunday, I would say Sunday or Monday, if I'm correct, and he had this itching on the skin, and then he developed local urticarias, and urticarias were quite intense. It was this big, this big urticaria, right? It was this big. He was being treated by some local allopathic doctors, and was no improvement. So then I was being contacted. I said, I can take your case, sir. What I did, I took the whole case, and it was a clear case of sulfur. Clear case of sulfur. Sulfur 30 potency, one dose. Urticaria went away in less than 10 hours. Less than 10 hours. Who says homeopathy is slow? Is homeopathy is slow? Homeopathy is not slow, right? Only in 10 hours, which he was suffering from few days, 30 potency. How? This aphorism, 191. Whenever I see local disease, I tap my head and I say, Krutik, this is the time to use 191. So in this way you work, you get a lot of success, right? 191 in continuation to 192. How to treat? Supposed to give internal medication, but how to treat? Take a full case. Upar, if you have a God from the heaven on the earth, and he comes to you to take the medicine, God will tell you that, son, I want your treatment. What should be your answer? God, I need to take your case. Because without taking a case, we cannot understand individuality. Anyone, every God is different. So every individual remedy should be given, right? So in a way, take a case is completely a need. Then only you can reach to the perfect part. But after taking a case, what is important? 3 points. Along with exact character of local affection, right? What is what you have observed, everything. First part, observation, local exact, symptomatology match, complete match. Then ODP, previously noted when no medicines have been used, right? Past history. And then pathogenic effect should be matched. What is to be cured in the disease? If a person has, say for example, eczema on the leg, right? And you are between the two medicines. One remedy is sulfur and second remedy is aconite. See, chief complaint is eczema on the leg. Which remedy you will give? 9 out of 10 times, if both the remedies are equal in totality, you will go with sulfur. Why? Because the pathogenic effect, sphere of action, is more on the skin with sulfur. So Hahnemann says in 192, take a full case, find PQRS, complete your case by ODP, everything, and select the medicine with pathogenic effects. That is what Hahnemann is telling about prescription. And that is as a way, in a way, what Hahnemann tries to tell is treat the patient as a whole. Treat the patient as a whole. That's what Hahnemann tells in 193. Internal medicine can cure local disease. It's enough. So you have to tell yourself that are you targeting the branch of the tree, or you have to target the root of the tree to cut it off. If you remove the roots, that local disease will go lifetime, will go away for lifetime. So in a way, this is what 193 is all about. Internal medication, only internally chronic disease, only internally, in a way, short time, proving that the local infection depended solely on the rest of the disease body will be cleared. So what Hahnemann tells, symptoms are the outward reflection of internal derangement. Aphorism 8, right? What is symptom? Symptoms are the outward reflection of internal derangement. So how you are supposed to treat? Through symptoms, reach the internal derangement and treat. So we don't treat symptoms. We treat state with symptoms. So in a way, if you prescribe internally, covering local affection and general state, you will have a rapid cure, gentle cure, permanent cure. That's what Hahnemann tells in a very short time, proving that the local affection depend solely on the diseased body. This is for chronic, but for acute, for recent disease, for recent origin disease, one dose is enough. For acute, one dose. I prescribe the son of a minister, honorable minister of the state, sulfur 31 dose. I told him that you call me after 3 months, 3 hours, or I will call you. I want to know how are you responding. He said I'm 50% better when we talked after 3 hours, and in few hours the case was solved. This is the magic, and when there is a magic, there is no logic, right? This is how homeopathy works, right?